Well, fewer than 20% of Americans have received the updated COVID-19 vaccine, according to a new CDC report. Flu vaccine rates are also very down this season.
That's right. Joining us live is infectious disease expert Dr. Hotez with the Baylor College of Medicine. Thank you so much, Dr. Hotez, for taking the time to speak with us. Now, we knew that COVID vaccine rates were falling, but why do you think fewer people are getting the flu shots?
Well, I think they both are related. I think people don't fully understand the benefits of getting these vaccines. So let's take each one separately. First of all, for influenza, fewer than 40% are taking the flu vaccine. It's a very safe vaccine. The technology's been around for decades. But people don't realize that in addition to the fact that flu is a respiratory illness, it's been associated now with heart attacks. So your risk of getting a heart attack or stroke if you have influenza goes way up, and people need to know that one of the best ways not only to prevent you from getting sick and hospitalized, but to protect your heart health is to get your flu vaccine. So that message needs to get out. The other, with regard to COVID, and I'm going to start to sound like a broken record now, is actually a similar type of problem. The COVID virus, the SARS-2 virus, not only a respiratory virus, it's a thromboembolic virus that causes strokes and heart attacks. And once again, one of the best ways to protect your heart health is by keeping up with your vaccines and immunizations. The other thing that a COVID vaccine, whether it's a booster or annual immunization, will do is it will reduce the likelihood of you getting long COVID. So about 6 or 7% of Americans who get COVID develop long COVID, prolonged symptoms, either neurologic or brain fog, as they call it, or exercise intolerance. And again, keeping up with your vaccines is the best way to prevent those things from happening.
Doctor, is the latest version of that COVID-19 vaccine effective, though, against some of the new variants?
It looks that way, and that's really good news. So I'm glad you asked that. So it was prepared against a variant that was out in the fall. The Novavax vaccine and the two mRNA vaccines are slightly different, but they both protect against the currently circulating variants and the ones that are projected to. So absolutely. So it's really imperative that people get it. And by the way, unfortunately, one of the drawbacks of the mRNA technology is not as durable as we'd like it. So if you got your annual immunization in the fall like I did, starting around moving into January, you may want to get a booster if there's a lot of transmission going on.
Dr. Hotez, is there a specific age group that needs the COVID vaccine the most?
The most are older Americans, certainly if you're over the age of 65. But even those that are not that old can still develop long COVID and heart symptoms. So it's really important you do that. Also, if you have underlying risk factors because of underlying diabetes or if you're immunocompromised, that also puts you at a very high risk group. By the way, not only for COVID, but also for influenza. The two go hand in hand, and you can actually get both vaccines at the same time.
What about for children? Because I do know that pediatricians, a lot of clinics host those weekend drives where you can get the influenza shot. So what do you recommend when it comes to children and getting the flu vaccine?
Absolutely. So over 6 months of age, we tragically lose 100, sometimes over 1,000 kids every year to influenza. It's still a bad actor, and that's the reason why we recommend it. It's a very, very safe vaccine.
All right, Dr. Hotez with the Baylor College of Medicine. Thanks so much for explaining.
Thank you.